viewers, I'm Okorie Goodness Amarachi. I want us to discuss gonorrhea as a topic for today's program. Please don't forget to like and share our videos. But first of all, I want us to understand what gonorrhea is all about. Gonorrhea is an infection caused by sexually transmitted disease, which is bacteria, which is a microorganism that affects both male and female. Gonorrhea often affects the uterus, which is the vagina, the rectum, and also throat. In females, gonorrhea also affects the pelvis. Gonorrhea is commonly spread during vaginal, oral, or anal sex, but babies of infected mothers can be infected during childbirth. In babies, gonorrhea can affect the eyes. Symptoms of gonorrhea. Gonorrhea infection causes no symptoms. Symptoms, however, can affect many sites in your body, but commonly appear in the genitals, which is the reproductive organs or the private parts. Signs and symptoms of gonorrhea in male include painful urination. We also have pus. It is a thick yellowish liquid that forms in wounds when they are infected. We have pain or swelling in one testicle. This body part makes sperms and hormones. Other names for your testicles are called make testes. Signs and symptoms of gonorrhea in women include we have painful urination also. We have increase in vaginal discharge. Sometimes a woman, when you go to the bathroom to ease yourself, you see some liquid or substance coming out from your vagina. Some of them are causes of gonorrhea. So when you discover such thing, it's better you see your doctor for treatment. Then we also have vaginal bleeding between periods, such as after vaginal intercourse. Then we have abnormal or pelvic pain. Gonorrhea at other sites in the body. Apart from all these private organs or reproductive organs, symptoms of gonorrhea can also be seen in other parts of the body, such as we have the rectum. Signs and symptoms include anal inching, which is your private parts inching you or your private organs inching you. We have pus like discharge from the rectum. We have spots like discharge from the rectum. We have spots of bright red blood on toilet tissues and having to strain during bowel movement. Then we also have symptoms like I told you before. Apart from the private organs and the reproductive organ, gonorrhea can also be seen in other parts of the body. Then we also have eyes. Gonorrhea symptoms in your eyes. Gonorrhea that affect your eyes can cause eye pain. It can cause sensitivity to light. Maybe each time you are seeing light, you'll be feeling some abnormal pain. Then we also have pus like discharge from one or both eyes. Sometimes you see some kinds of fluid coming out from your eye. Sometimes it could be one eye and sometimes it could be both eyes. So all these are symptoms of gonorrhea on the eyes. We also have throat. Sore throat. Maybe each time you want to swallow saliva, you'll be feeling some kind of abnormal taste or pain on your throat. Signs and symptoms of gonorrhea also affect other parts of the body. It also affects the joints, which is the septic aritis. The septic aritis is an infection in the joint. It occurs more often in children than in adults. In some cases, joints may become infected due to injection, injury, or surgery. The affected joint might be warm, it might be red, it might be swollen and extremely painful, especially during movement. It can be in a form of red joint, swollen legs, or swollen joints. When to see your doctor? Make an appointment with your doctor if you notice any troubling signs or symptoms, such as burning sensation when you urinate, or a pus like discharge from your penis, vagina, or rectum. It is advisable you see your doctor. When you have painful sensation, when you see all these pus discharge from your vagina, from your spectrum, and from your penis, it is advisable you see your doctor. Causes of gonorrhea: sexual intercourse. Then we also have risk factors of gonorrhea. Sexually active women younger than 25 men who have sex with men are at increased risk of getting gonorrhea. You see, So it is not advisable as a young lady or a young guy that is not legally married to start having premarital sex, because you can easily contact gonorrhea. Other factors that can increase your risk include having a new sex partner. We also have having a partner who has other partners. You see the reasons why you shouldn't involve yourself in premarital sex. We have complications of gonorrhea. Untreated gonorrhea can lead to major complications such as infertility in women. Gonorrhea can spread into the uterus and fallopian tubes, causing pelvic inflammatory diseases, which is the PID. Pelvic inflammatory diseases can result in scarring of the tubes, greater risk of pregnancy complications and infertility. Gonorrhea can also cause infertility in men. Gonorrhea can cause a small coiled tube in the rear portion of the testis where the sperm ducts are located. The bacteria that causes gonorrhea can spread through the bloodstream and infect other parts of your body, including your joints. Fever, rash, skin sores, joint pain, then swelling and stiffness are possible results of gonorrhea. Increased risk of HIV or AIDS. Having gonorrhea makes you more susceptible to infections with human immune deficiencies virus, which is the HIV that leads to AIDS. People who have both gonorrhea and HIV are able to pass both disease more rapidly to their partners. Complications in babies. Babies who contact gonorrhea from their mother or who contract gonorrhea from their mothers during birth can develop blindness, sores on the scalp and infection. So it is advisable as a pregnant woman or as a lady or as a woman to always go to the hospital to treat gonorrhea, because sometimes this gonorrhea doesn't have signs and symptoms like I said before, so that it will not affect your unborn children. Then prevention of gonorrhea. To reduce your gonorrhea risks or to reduce gonorrhea risks. Prevention of gonorrhea. To reduce gonorrhea risks, it is advisable if you are not a married couple to abstain yourself from premarital sex, because abstaining yourself from sex is the surest way to prevent gonorrhea. Limit your sex partner. As a married couple, you should be faithful to your partner so that you not end up contracting gonorrhea outside. Be in a monogamous relationship in which neither partner has sex with anyone else can lower your risks, you see. So it is advisable you have just one sex partner, which is your wife or your husband. Be sure you and your partner are tested for sexually transmitted infection. To reduce risks of gonorrhea, also consider regular gonorrhea screening. Annual screening is recommended for sexually active women younger than 25. For older women at increased risk of infection. These include women who have a new sex partner, more than one sex partner, a sex partner with other partners, or a sex partner who has a sexually transmitted infection. Regular screening is also recommended for men to avoid gonorrhea again and stay from sex until you and your partner have completed treatment and after symptoms are gone. It is advisable you abstain yourself from premarital sex. This brings us to the end of today's edition of this program. Please don't forget to like and share our videos, and do well to subscribe to our YouTube channel. I remain your favorite host, Okore Goodness Amarachi, and in case you have any comments, don't forget to drop it on the comment section below. Thanks for watching. Bye.